Assisted suicide, euthanasia, and palliative care. We hear these terms more and more. Lawmakers in Illinois and Uruguay recently advanced measures related to euthanasia. And as we just heard, many countries have legalized some form of assisted suicide. But what are the differences between euthanasia, assisted suicide, and palliative care? And what does the church teach about these practices?
When it comes right down to it, is murder.
Euthanasia is the act of deliberately ending a person's life by a medical professional. Supporters say it is a way to relieve someone of their pain and suffering. They add patients are often living with a serious or terminal illness and are in the final stages of their lives. While this might sound merciful, it isn't. We see cases where people are not terminally ill or where there is a form of coercion. The church strongly opposes this practice in all forms. Euthanasia can be broken down into 3 categories: voluntary euthanasia, when the patient requests to die; involuntary euthanasia, when a person is murdered against his or her wishes; and non-voluntary euthanasia, when the person is not capable of giving consent.
You typically would consent in the beginning of the euthanasia process, but once your consent is given, there's a more possibility of you changing your mind. I don't know any other medical treatment or quote unquote medical treatment where this is done. There's been multiple examples where patients who at one point consented to euthanasia decide that they no longer want to be euthanized. But if you've already given up your rights, then you're essentially forced into it.
Assisted suicide, sometimes referred to as physician-assisted suicide, is when a doctor or medical professional provides a patient with drugs to end his or her life. The Catholic Church condemns both assisted suicide and euthanasia. According to the Catechism, any action or lack of action that intentionally, quote, causes death in order to eliminate suffering constitutes a murder gravely contrary to the dignity of the human person and to the respect due to the living God, his creator, unquote. The Church teaches that bodily death, from which man would have been immune if he had not sinned, is the last enemy of man to be conquered. To rise with Christ, we must die with Christ. That means grappling with and accepting our natural death. But we don't have to do this alone. The Church supports and endorses palliative care. Palliative care is focused on providing relief from the symptoms and stress of serious illness. The goal is to improve the quality of life for both the patient and the family.
In palliative care, we are recognizing the dignity of the person and the worth of the person, and we are applying our best efforts to try to relieve suffering and help that person to experience their life as meaningful, to the greatest degree possible.
Sister Constance Veit has been with the Little Sisters of the Poor for more than 30 years. An important part of her order's mission is to care for the elderly who are sick and also need financial assistance. She says her and her sisters are not experts on dying or palliative care through study, rather through practical life experience, something she says the faithful can do too.
And I think you don't have to be a professional caregiver to learn a few skills to be able to be a meaningful and caring presence around the dying or the chronically ill. It's not rocket science. It's human warmth and decency and caring. And if there were more people available to provide that, to support family caregivers, or to come into homes and spend time with people to relieve the burden on family caregivers, or just to spend time with someone who's in a very vulnerable position, I think there would be less temptation to want to end one's life.